Here. Present.
Present. Wonderful. Thank you so much. And can we have approval of the minutes from October 22nd, 2018?
So moved. I'll second.
Perfect. All in favor?
Aye.
Aye. Any opposition or abstentions? Wonderful. The minutes are approved. Anyone here to make comments from Neighborhood Council? No. I don't see anyone. Public comment? Any public comment? All righty. Let's move on to item number 1.
Madam President?
Yes.
Is public comment now closed?
Public comment is closed. Moving on to item number 1, introduction of new commissioner, Ms. Lorraine Estrada. Welcome. If you would like, you have a few minutes to talk to us about who you are, what brought you here, and what you hope to achieve in the commission, or just introduce yourself.
Okay. Well, I'm not used to talking about myself, but right down. Can you hear me? Can you hear me?
Yes.
Okay. Well, I guess I could start with saying I was born and raised in Los Angeles, as were my parents and my parents' parents. So I guess I could say that I'm a native Angelino. I attended high school in Los Angeles and obtained a Bachelor's of Science degree in nursing and a Master's in public health, both from a university in Los Angeles. I am a registered nurse and have practiced nursing, but now practice as an administrator in healthcare. I'm currently the Chief Executive Officer of Arroyo Vista Family Health Center. Arroyo Vista is a nonprofit community health center, federally qualified health center. It was established in 1981 to provide primary and urgent care services to federally designated medically underserved and health profession shortage areas in Los Angeles. Our service area is primarily northeast Los Angeles, but we see patients from everywhere in Los Angeles. And we focus on the 5-stage life cycle, which is prenatal, OBGYN medicine, pediatric medicine, adult medicine, family practice, and geriatric. We also provide comprehensive dental services, some specialty services, optometry services, radiology, health promotion, disease prevention, and also imaging services. And we are so proud that through our Ruby Cedillo breast cancer program, we provide women's health exams, breast exams, mammograms, and patient case management. We're also affiliated with universities and are a clinical training site for medical students and graduate nurse practitioners. We accept patients with private insurance, Medi-Cal, Medicare, and uninsured patients. For patients that are uninsured, there's a sliding fee discount for patients at 200% poverty and those at 100% poverty or below a minimum fee. We are accredited by the Joint Commission of Healthcare Organizations, and I want to take this opportunity to thank Councilmember Cedillo, who recommended me or nominated me to this commission, and to thank each and every one of you. I am honored to serve with you, and I look forward to serving with you in working to improving the public health of our City of Angels, working to improve health outcomes and decrease community health disparities. I am honored to serve you, and I look forward to working with you and meeting the achievements and expectations of my membership on this commission.
Wonderful, wonderful. Thank you so much, Commissioner Estrada. Any questions for the rest of the commission?
Which council member are you appointed by?
Cedillo. Councilman Cedillo.
Okay.
Yes.
Okay. All right.
Item number 2.
Item number 2. Are there any comments, public comments for item number 2? So we do have one comment for item 1. Comment card says Black Puppet. I'm not sure who that is. Item 1.
so go ahead. The reason, motherfucker, I'm so late is that I go down to the first floor there and some big motherfucker stop us from coming in. You are obstructing a Brown Act meeting, you motherfuckers. You're not letting people in. The only reason I got in is because these normal-looking white folks come in, or my black ass would still be out in the goddamn
Speaker's
street.
off topic, Madam President.
No, it's not.
Please stay on topic, please.
Yeah. Haven't you learned since the FBI raid your ass is next? You keep fucking with my rights. Now, we want Lorraine Estrada's. This crazy sister want to be on this commission? Fuck no. You don't want to go anywhere near this commission. This commission is haunted. It's haunted by the ghost of a former council member. Yes, sir, an actual council member formed this commission, and he died immediately thereafter. He went to one meeting. So we know that this goddamn thing was cursed from the day it was born.
Madam Speaker, speaker's off topic.
Yeah,
Please
I'm
stay on
not.
topic.
How the fuck can I be off topic when I'm talking about how you serve on a commission, which I am talking about? I'm talking about the goddamn serving on a commission and that you shouldn't serve. How is that off topic? You know what? These guys down here, Miss Estrada, they don't learn nothing. I'm telling you, the FBI raided this entire building just a mere 2 weeks ago come tomorrow. So if I were you, I'd get the fuck out of this building right now, because the last thing I would want to do is have your nonprofit audited by Donald Trump. That's right. So get off this commission, nice lady.
Item number 2, update on Los Angeles City Health Commission vacancies. We have public comment. Black puppet.
Okay, as I understand how these rules work, we're supposed to have 15 brothers and sisters here representing one per council member. Now, I know that Jose Huizar has to appoint one member of this commission. Any of you were appointed by this criminal? If you were, I'd get a good attorney, because you're going to goddamn need one real soon. Because Jose Huizar has tainted this whole building, including this commission. So we got 1, 2, 3, 4, 5, 6, 7, 8, and I believe Mr. Cedillo, a.k.a. Gilbert Cedillo, a.k.a. the most hated council member. Did you know that your friend Herb Wesson tried to get Gil Cedillo kicked off this council? Did you know that? And we found out about it, and we put his big boot up that nigga's ass and got him reelected.
Madam
Yes,
Speaker,
sir.
speaker's off
And
topic.
that's
Stay
the
on
reason
topic,
why.
please.
That's the reason why. See, I am totally 110% on topic, sir, because I'm talking about how somebody puts a vacancy on this commission, and that's done by council people. So if I'm talking about council people, I'm talking about vacancies, I'm talking about appointing vacancies. I'm clearly on topic. Don't let my color fool you, fool. I am an educated black man. That's right. I am not like the rest of you goddamn sellouts. I go to the law library every Tuesday till 8 o'clock with my friends, and I'm reading every day something called the law. And the law says, fuck you.
So at our last commission meeting, I gave a report back that I had sent emails to each of the vacant council districts, or the council districts that had commission vacancies. There has not been any follow-up since then. I am planning to send another email because we still didn't get responses from Council District 6 or 7 regarding the vacancies for the Health Commission. So I'm going to send in another email out, and we hope to get some more folks on the commission, but I am happy that we did get someone from Council District 1. So our efforts did produce one new commissioner. We just need to push a little more to get some more folks in. I am open at this point to any other suggestion as far as strategy and how we can try to get this pushed forward. So just to reiterate, so Council District 1, that vacancy has been filled. We still have a vacancy in Council District 3, Council District 6, 7, 12, and 13. 5 of the seats. So I am open to hear from you all. Any thoughts? Should I just send that other email out again? I don't know if that's going to do anything, if there's any ideas about another way to try to approach this issue.
Excuse me. Did you say
Yes.
5? Isn't 5 correct?
1, 2, 3, 4, 5 vacancies.
Oh, you didn't say.
Blumenfield, Martinez, Rodriguez, Englander, O'Farrell. Yeah. Yes.
We've also had some folks not showing up lately as well, so I just wondered, at some juncture, we may want to follow up on that. 'Cause,
Right. Okay.
Solace tells me that you haven't heard from some folks, so nice to know what the situation is.
Okay. Very good point. So I'll ask Candy to give me, she at one point previously had given me a sort of a list of attendance. I'll ask for that again. So we can also follow up on those. So we may have now more than 5 vacancies. We just don't know yet. So I will ask for that. Other ideas, comments? Thank you for that. That's important for us to consider.
Have those seats, have those council members or their staffs responded to the names that we suggested would be people who would be willing to be nominated and serve?
No. So I sent them all of those candidates. Well, I'll take that back. Yes. One of them said, hey, could you please screen any of those potential candidates to see if any of them have any connection to the council district in question? And I didn't have the time to do that.
Okay.
So I did not do that. But all of them did receive that, and I think we had a conversation at one point or a discussion about this. It sounds like the want is for people that live in that area or work in that area to be tied, there to be a connection, and some of the folks on that list don't necessarily have that connection. So I think a lot of them are in Council District 9, some in Council District 10, Council District 8. So for someone in Council District 13, they are not necessarily interested in pulling someone or appointing someone outside of the council district. So that's kind of where that ended. But I think one of the strategies, because we've talked about this before, that you don't have to live in the council district. As long as you live in the city or work in the city, you're good. So that is a point I can reiterate as well. So I will keep trying to my best of my abilities. But again, if anybody can think of anything, any ideas, please let me know. And if maybe you've talked to someone that lives in any of those districts and like, hey, they would be a good fit, let me know as well. Other thoughts, questions? Uh-oh, okay. Okay,
Excuse me.
yes.
Is there a proper procedure to follow to contact people or to contact a council member to see, why they're not interested?
I don't think so. I think we could call the district office and ask, right? Yeah.
There's no specific procedure that I'm aware of, no.
Okay, so any commissioner can contact any of the council members who has a vacancy?
Yeah.
As far as I understand.
Okay.
Yeah.
If the city clerk could, would it be possible if we would all be notified of how long each of those council districts were not filled, because some of those, it's a year and a half, if not longer. It'd be interesting to see. I mean, obviously, O'Farrell's a relatively short period of time, but all the rest of those are at least, I think, 8 months, and I think a couple of them are going a year and a half or two. And that'd be an interesting thing. And the reason I suggest that or bring that up, and it might be something for us to discuss whether we want to really do this or not, but it'd be interesting if the LA Times would care. It's a dereliction of their duty as council members not to appoint something that the law says they're supposed to be doing.
Yeah, and I think the other part of it is we have asked, and it's been even just more than us. AIDS Healthcare Foundation sent that letter initially, right? And then I sent this email, so it's not, this didn't just happen today. This is something that has been requested at least twice. Okay. I'm taking notes. Other questions or comments? No? Okay. All right. And then we are moving to item number 3, update on Los Angeles City Health Commission Annual Report. I have a comment card. This comment will be for 1 minute from Black Puppets.
What's a nigga got to do? Only getting 1 minute now? How come I got 2 minutes before? You women are just crazy, all of you crazy. So, you don't even have a legitimate quorum of 15. You got to have at least 8. I see 1, 2, 3, 4, 5, 6 puppets. Now, if you want to include me, that would be 7 puppets. If you want to include Mr. Spindler, that's the only way there's going to be a goddamn quorum here. There ain't no quorum.
Please
This
stay on
place
topic,
is turned
thank you.
into a joke. It's all you can do, lady, is try to protect the corruption in this city. But you can't anymore. You are under FBI investigation now. So there ain't nothing you can do now. Now, the minute you fuck with us, the FBI gonna raid your ass. So I'm gonna talk. Now, I'd like to...
Okay, so we have been. Oh, is it got a comment card? Okay, awesome. Mickey Jackson? Oh, wait, this is item 4, right? Or you item 3 or item 4? I'm sorry.
I think I'm item 4. I was
Okay.
going to talk about stuff coming up. Should I sit down and wait?
It's up to you. We're on.
Oh,
We're
I'll just talk since I'm here. It'll be just as quick. Mickey Jackson. I'm with Healthy Housing Foundation, a project of AIDS Healthcare Foundation. I was listening to what you said earlier, and yeah, we've all been trying to do something about that. So that's good to hear that we're going to keep trying. The other thing I was going to talk about just for a minute is the county is taking up looking into County General Hospital as possible housing. As you may know, Healthy Housing HF, we've been asking the county for over 2 years to look at that. And, you know, both publicly and then talking to people we know, getting people we know to talk to them. And we're very pleased at that. We're very sorry that the city didn't do the same thing with Parker Center. And even though there's been a lot of demolition on Parker Center, it's not demolition that is beyond the capacity to turn around. And I think that was maybe one of the biggest opportunities the city had to do housing. And a person who was ever so involved with pushing the demolition in all different venues that he was at is now a person who is under investigation. And he with the mayor and perhaps Mr. Wesson were its biggest champions of demolition and of the grand project to take its place that houses no one, unless you count putting a tent up next to a big fancy building. And it's something that I think we could maybe take a breath and look at, because some of the decisions that have been made in committees and other places where that individual was involved could be called into question.
Thank you. So a quick update on the LA City Health Commission annual report. Our commission intern, Matt, has been working very, very hard on the report. And as of now, I wouldn't do it, he did it. He has connected with Dr. Eckstein from the fire department to get updates on some of the data for the report. And it's a little bit hard, and I think you guys know, it's a bit hard to get in touch with Dr. Eckstein, but he was able to actually go down there and kind of catch him and speak to him directly. So we're waiting on the updates from him. And he's also working with Dr. Lewis at USC, Dr. LaVonna Lewis at USC, as well, to get some further input. So from what I understand, we should have a final draft in December, but we probably won't be meeting in December. So January will probably be the best date for us to kind of get everything wrapped up. Questions? Concerns? Matt, do you want to add anything? Say anything? Once again, we always appreciate him and his hard work completing the report and going to school, medical school. So, appreciate that. Okay.
Thank you.
Awesome. Item number 4. Discussion and or action on health topics for 2019. We have... Oh, that's right. Have no public comment. The 5-minute max comment per meeting was already met here. So, I took everyone's suggestions that we had, I think, over the last 2 meetings, came up with important health topics, tried to consolidate them all, but I need your input and suggestions on potential speakers. So I'll read each of the content areas, some of the topics, and if anyone knows of any person to include, please let me know and I'll jot them down. So the first topic is Plan for a Healthy LA Follow-Up. And with city planning to see if there's been any updates to the work that was done. And so today I went on their website. I couldn't find a contact person, but I found a contact email that we can use. But I didn't see any activity on that site since 2015. So I don't know if there's been any work done. Commissioner Cato?
We had a report from someone from city planning. Dr. Mandel, do you remember her name? It was like in 2017. She gave an update here to us.
Maybe we can pull the minutes.
Yeah, if I...
Okay. Sure.
But there is I think there's one person in city planning that's following this.
I remember that.
Not everybody in the department knows about it. But
Right. Okay. I do remember that presentation. Okay. Okay. And then there was a topic around consideration to be made for healthcare facilities near hospitals to avoid transportation issues, people getting to and from healthcare. So I did make a quick list. I figured we could contact someone from the Department of Health Services and perhaps someone from the Community Clinic Association of LA County. And I have some contact information for both of those. But if anybody else knows anyone that is working on healthcare as far as issues of getting people to and from their source of care, let me know. But that was at the top of my head.
Do we know if the H funding representative has someone who's dealing with healthcare issues for H funding, or same thing for HHH? Because there might be a staffer who's dealing with the interface between homelessness and resources
Got it.
with the funding, because they may be the person who has the most abilities to give us information that would be beneficial.
Got it. Okay, perfect. Any other thoughts about that one? The other topics I combined, so there was a question about enough hospital beds in the city of LA, emergency room time wait, and emergency mental health beds. And in my research, I thought that the best person that could answer to those three questions would be the director of the LA County Health Agency, the interim director, Fred Leaf, since a lot of that seems to fall under his jurisdiction, but I'm open. So it's hospital beds. Do we have enough hospital beds? How long is the emergency room time wait? And how many emergency mental health beds are available in the city?
The part of the county that is most directly involved is in the Department of Health Services. There is an Emergency Medical Services Authority. It's operated under the aegis, excuse me, of Kathy Chittister as the person who's the executive director. And they've been doing studies of the wall time issue and quite a bit also about the mental health beds availability. So it might be, in conjunction with Dr. Eckstein or something, it might be useful to ask her or someone from that department to come and discuss those issues, because they're kind of right at the forefront
Perfect.
of things we're concerned about. The lack of mental health beds adds to the wall time, as they call it, the standing around waiting. And as we know, Dr. Eckstein has initiated some things that are trying to alleviate at least some of the issues around that. But I think in general, and since that's a major health component of the city,
Right.
it's useful. And since there is this direct county interaction, because anything that the city does has to be approved by the county in the emergency medical services, and that's actually on behalf of the state. But somebody from that can part along possibly with Eckstein or something might be useful to
Perfect.
discuss and see if there's a role that the city could take, because it's a little tricky. I mean, we can't impose beds on them or something, but maybe we can, learn more and see if there's something we can do.
Okay, perfect. The only thing is, it's so hard to get Dr. Eckstein here. He still practices, so he oftentimes has meetings or clinic, and he can't, so Mondays seem to be very difficult. But I will ask him if this person you mentioned.
He is also at County USC, so he's two places, the
Yeah.
fire department and at County
Do
USC.
you have a chief of staff?
I'll ask.
Perhaps the chief of staff or a deputy
Right,
chief can present instead?
okay. Good idea, thank you. Okay, so the next item I have is safe parking and bridge housing. Someone was asking at one of the previous commission meetings about getting an overall view of these two programs. I don't have any thoughts or ideas on who could speak to that. So again, it's safe parking and bridge housing. And the safe parking is when people can park in designated areas overnight and sleep, and there's typically facilities for them to use. And I'm not even really sure what bridge housing is. Do you remember? Does anybody make that comment?
Yeah, bridge housing, it's a temporary shelter that isn't going to be using HHH funds, because that's more for permanent supportive housing.
Okay.
But because it's going to take longer for that to be built, it's a proposal to put up temporary shelters using storage containers or quick fix. The first one was opened right by Olvera Street. They're planning to open, hoping to open one in every council district. And, they're doing outreach to get the neighbors to go along with having it in their area. There's a lot of, fight back to not be near, their place.
Right.
And it has a 3-year lifespan. I think that's set by like the so it could only go up for 3 years. That's why they call it temporary housing. It's called bridge housing here. The mayor's office, they have a special task force that works with that. I don't know who's in charge of that.
Okay, but that's a good start.
Okay, safe parking, this is a nonprofit that's been set up, and there's a couple, the Cohens, Ira, and I can't think of his wife's name right now. They're the ones that are spearheading this, and they're going out trying to do outreach with the neighborhood councils. So I think the Cohens might be a good person to come and present that, and I can give you their information later.
Perfect. Okay, thank you. And then there was a topic that says invite admins from Prop H and Prop HHH and County DHS to talk about the money funding that would allow for homeless to have a medical home. After reading that, it sounds very much linked to the earlier discussion about considerations made for healthcare facilities near hospitals. And your point about trying to find whoever the lead is for Prop H funding to see if there's a link between the healthcare and the housing. So I think we can combine these two together. Okay, perfect. The next topic is alternative housing. There were two separate items. I combined them. So Commissioner Grimming had found an article from about USC, some article that had come out that proposed alternative housing and was able to quantify sort of a low-cost option. So he sent that article, and the place is called the Homelessness Policy Research Institute, and I was able to find a contact. Gary Painter is the director of that institute, so we could possibly hear more about the solutions for this alternative housing. And as was mentioned earlier, County General is, they are thinking about turning County General into a potential housing site. So I found out that Solis, who's the supervisor for District 1, is behind that push. So it sounds like it would be a good idea to get someone from her office to speak on that so we can get a better understanding of potential solutions, longer-term solutions to the housing issue. Does that work? Gary Painter from that? Okay, perfect. And then the last one was the STI rates in the city of LA, so sexually transmitted infections. And the only person that two people or two organizations that I thought of, Mario Perez, who runs the Division of HIV and STD programs for the county, and of course AIDS Healthcare Foundation. And I know there are others, so if there's anybody here that's maybe well-versed in STD prevention. There was some concern about the focus being too heavy on HIV, but not enough on other STDs, and that testing rates for other STDs don't reflect the burden of disease in the city. So that was the full sort of blurb about the concerns that I think that was Commissioner Ossie that brought that concern up. So those are the two folks that I thought, the County Division of HIV, STD, and AIDS Healthcare Foundation. Is there anyone else that is doing work around STDs, STIs that we could bring in?
UCLA has, part of its School of Public Health has research also on this.
Okay.
Community health centers in LA County provide STD screenings, like Arroyo Vista.
Okay. So would that be like the Community Clinic Association of LA County, kind of bring in some, okay.
Yes.
Perfect.
How about the AIDS Healthcare Foundation?
Mm-hmm.
They're pretty visible on that topic.
Right. Okay. All right, so I will repopulate this list. And I think, I had wanted to ask which month, I think we just try to just start with it, go from the top down, and see if we can get folks in here so we can hear about these different issues that are of concern to us. I think we have a really good list here. I think these are about 8 or 9 separate topics, so that we have a few months to talk about the report, go over the bylaws, have our elections, so we have some sort of space and room to maneuver. Okay? Any other thoughts about our topics for next year? exactly, that was exactly. Okay? Other questions, concerns? So this takes care of the topics and also the items for future discussion, kind of same thing. So if there are no other comments or questions, we're done. Who, move to adjourn? Yeah, thank you.
Just wish everybody a happy Thanksgiving. We're all thankful for living in this great city.
Well said, well said. Okay, so you move to adjourn, is there a second?
Second.
All right, all in favor? Aye. Any opposition, abstentions? We are adjourned.